Welcome to this special edition of WMAR2 News. I'm Kelly Swoop.
And I'm Mallory Safaste. November is National Family Caregivers Month, and tonight we want to take some time to share some information that can help a community that often goes unnoticed.
You know, as our parents age and as life takes its turns, sometimes there's a bit of a role reversal. The child becomes in the role of the parent, and the parent often the role of the child.
And we're working for you. We want to show you scams that are targeting the elderly, ways to save on prescriptions, and more.
But we start with a look at how caregivers can take better care of themselves and the ones they love.
Caregiving is a term that we tend to use in aging services, but people who are out there caring for another many times just do it because that's what they were raised to do, that's what they believe is the right thing to do. So they don't often label themselves as a caregiver, but it's important to access resources. So knowing that if you're caring for a relative, either every day, all day, or even just periodically helping them with special things at home, then you're a caregiver, and it's important to know that there are others out there like you and that there are resources.
Kind of get her to the point of it. Christina Fitz spent years working in corporate development, but as her parents began to age, she sensed the need for a career change.
My parents' care has always been a concern with me. My mom had a health scare back in 2010, and what I noticed was that you need an advocate in the hospital. You need an advocate with someone who's elderly anyway. My dad had a health scare probably 2 years after that, and both of them had mild strokes. But what happened really made me feel that I needed to create an environment that they could be safe in, where they could have advocates all day long, or somebody that would care for them the way that a daughter or a son would care for their parents. Hi, how are you?
Fine,
I'm Christina.
Nice to meet
Nice to
you.
meet you
I met
too.
your mom already.
Oh, yes, yes. I started A Perfect Fit really because I felt that there was a void. And the void that I felt was individuals who have come to the point of aging, they're not ready for nursing home, they can't stay at home by themselves. And I didn't want them to be left out, and I felt that this void could be filled, and if I created a home that was loving, warm, and inviting to someone.
Our cameras spent a day at Perfect Fit to see just how assisted living is set up. While her parents have now fully recovered, Christina credits their constant work in assisted living for keeping them healthy.
It may be downstairs.
They feel very much like they have a purpose here, and I create a purpose for them. My dad not only is very involved in the care and supporting some of the other members here, but just being someone of that age, talking with the other individuals, they have a lot in common. They can talk about things that happened in their past, especially if they're from the same neighborhood.
I feel much better since I've been doing this physically and mentally. In fact, several people have commented on the fact that I look much better since I've been coming over and engaging in all the activities that we have on a daily basis. They really feel like family. They really do.
It's a family affair.
We look over here to this is Coach's room. All my parents are the best and most supportive people, but truthfully, I saw the aging process with my parents too. And I said, let me create something where I can keep them involved, but I can also have something that they can look forward to in terms of being with family. So the main thing that they've done is just encourage me and be a part of it and be very active. I got my mom certified as a med tech. My dad is also the barber here. And even though he's with his contemporaries, you know, he does the same part that the caregivers do. He helps to prepare the meals, he sits down and he talks with them, and he also will take them to trips if he needs to. Then they can kind of go down memory lane together, and it just keeps them very involved, because also you have to consider that when they become a certain age, they're looking at a lot of their friends are dying. And or very sick and not able to get out and do what they used to do. So it's very important that you keep them engaged and active.
Dr. Samus of Johns Hopkins couldn't agree more.
We really encourage people who have memory problems and people who don't have memory problems, who are older adults, that they really keep up with their social interactions and their social engagements, because we know that it's, your brain is like a muscle. The more you use it, the more it will, the connections will stay healthier. And so having positive social relationships and social engagement and meaningful engagement, like really finding in doing activities that you enjoy. All of these things have really been shown to be positive in terms of keeping people healthy.
And that's not just for the person being taken care of, that's advice for the caregiver as well.
Caregivers have to really take care of their social needs as well as their own physical and medical needs.
Burnout is definitely something that you have to worry about. I rotate with my staff. I still have a personal life. I still have children. They're older, but I still have to be a mom. I still have to be a wife. So I look at my caregivers and I say, hey, I need you to trade off with me. I need you to take this. And we do that for one another. But I sometimes have to step away to say, I just need a little time for myself, because it's going to be there. I'm going to be able to be there for them. But I can't be the best that I can be if I'm tired and if I'm not mentally as alert as I need to be.
One of the most common concerns of caregivers of aging parents is dementia. What are the warning signs? Can anything be done to prevent it? When we come back, we'll get those answers from Dr. Samus.
Welcome back. Although there can be various age-related illnesses, the ones associated with memory loss are often the scariest for both the patient and the caregiver.
So dementia is a term that we use to refer to a collection of symptoms. And these symptoms include cognitive symptoms, like people are most familiar with, like memory. The symptoms have to be something that are impairing life. So that could be like day-to-day life, how they're managing their groceries, how they're cooking meals, how they're doing their finances. And also socially, they may decide not to hang out with social groups that they usually do.
For most of us, we may walk to the fridge and forget why we went, but after a moment's time, the thought comes back to us. With dementia, that's not the case.
If someone has dementia, that is going to be something that happens more and more frequently, and it will be harder for them to reorient themselves to what they were trying to do in the first place, and it becomes more confusing. And so there's a few warning signs that we tell people to really look out for to kind of distinguish dementia versus normal aging. You might see a loved one all of a sudden really have difficulty putting together a grocery list, and then going to the grocery store and following the list and being able to get the groceries for the week. Difficulty in doing other types of familiar tasks may be a warning sign as well. So that may be that someone is driving, for example, and they're driving in a neighborhood that they're very familiar with, and then they begin to get confused or get lost while driving in a familiar place. Also, confusion with time and place. So, being confused as to where they are located, so forgetting that they're at their home. Spatial orientation. And by that we mean basically if they're walking upstairs, they may have trouble seeing the step and putting their foot correctly on the step so that they don't fall or trip.
According to Dr. Samus, approximately 50% of the people who have dementia right now in the U.S. have not been identified by doctors as having dementia. Caregivers often suspect that their loved one may have dementia, but they haven't been formally told, so they just keep on going until something dramatic happens. Sometimes it may be a car accident, and other times it could be getting scammed out of their money.
Caregivers should just be keeping an eye on their relatives' finances if that's at all possible. Unusual amounts of money that are disappearing, or some anxiety about finances, because oftentimes once you start to fall into these, you're embarrassed and you don't want to tell anyone.
There are many scams to look out for, the most prominent being the Irs Scam.
the IRS calls and says they're coming to get you and put you in jail if you don't pay a certain amount of money or give access to your bank account, and that's absolutely not true. Some of the others are the grandparent scams, where someone calls, identifies themselves as a grandchild, and says that they're in jail or they're in a hospital and they need money sent to them. Tell them you'll call them back on their number. Tell them, ask them a question that only they would know the answer to, because oftentimes it's someone that's just trying to scam you out of your money. Scams and fraud, the elderly are so vulnerable because they want to trust and they want to have friendships and they don't want to say no. And so it's very difficult sometimes to hang up that phone, and we try and teach people that it might seem rude, but if you didn't initiate that call and they're trying to sell you something or tell you something you're not comfortable with, it's okay to hang up the phone.
Data from the Department of Aging shows that oftentimes the elderly are being taken advantage of by their own family members.
Maybe it's their grandmother or their aunt or their parent actually, and they see that regular income coming in and think, well, just a little bit won't hurt, and it gets larger and larger amounts as well. So if you start to see mail piling up with past due notices, or just some of the things that they normally did they're not doing anymore, maybe it was even giving out holiday gifts, and suddenly they say, well, I don't have the money for that. If they're anxious when the phone rings, if they get anxious about somebody knocking on their door and they just weren't that way before, it could be that they're afraid to tell you, but that someone is taking advantage of them.
The conversation may be hard to jump into, but it has to happen.
We suggest using an example of someone else, or maybe there's a big story in the news, and you can kind of lead into it from that perspective, and then have that discussion about how are you protecting your finances. What would you do if you got a phone call? What would you do? And kind of walk through those scenarios.
There is new research that points to clear-cut ways to reduce both the risks of getting dementia and becoming a victim to scams.
So anything that is good for the heart is good for the brain. A lot of research is now focusing on preventive strategies, lifestyle strategies, health management strategies that focus on not smoking, not having excessive drinking, having a kind of Mediterranean type diet for a long period of time.
In Baltimore County, men over age 60 have found a way to stay active and social. At age 72, Charlie Cooper is running the basketball court 3 times a week.
I stay in shape, but there's camaraderie. In the time when our country's so polarized, guys of all kinds of backgrounds and political views come together here and treat each other relatively civilly. That's a good thing too. We have a lot of fun.
Team leader. But that role means trying to help the guys do the best that they can in many ways possible, getting showered and stuff like that. Team morale, I tell them, hey, this is what we got to do. That's basically it. For the first portion of the day, they just run half court, and the latter part is when I really take over in the whole court.
We have regular classes in our senior centers so that you can learn from the police department, from attorneys, from different consumer rights groups. So all of our senior centers have activities going on.
Go to our website, wmar2news.com. We have a list of activities and opportunities to get your loved ones involved.
And we're not done just yet. When we come back, we're going to shift gears and take a look at ways that caregivers can take care of themselves and also save you some money on prescriptions. As this project was coming together, the one thing that we kept hearing over and over again is that caregivers need to do whatever they can to avoid burnout. One option is respite care.
Respite care is a short-term stay. It's generally 2 weeks, but it can be up to a few months. All of your activities of daily living would be assisted here. You would also be able to participate in our activity programming. We would administer your medications. We would provide all 3 meals a day. We would really take over the entire care of a loved one. Sometimes people are traveling out of town and they're not able to offer any assistance during that period, and we take over everything. Lately, more and more people are finding that after a rehab stay at a skilled nursing, they're not quite ready to return home, but Medicare has determined that they're not making enough progress to stay in rehab. So our focus lately has been a transitional care program where people can come and stay with us for 2 weeks all the way up until a couple months until they really feel like it's safe to return home. And this is going to reduce the rehospitalization, which is super important to people living in the community.
What time is dinner today?
Alyson Lynch has served as a caregiver for her aunt, then her dad, and now her mom. Through the journey, she's learned a lot about life and the importance of self-compassion.
A lot of caregivers put a lot of guilt on themselves for not being enough, not doing enough. They don't take care of themselves. They don't take the time to look at the leaves outside or take a walk. They say that caregivers are at risk for dying before the people that they're caring for. And it's not just a myth, it's true. Don't wait years to have that knee replacement that you need or the cataract surgery that you need. Find resources, find somebody to help so that you can be taking care of yourself.
Alyson wasn't always this strong in her belief of putting her needs first. The stress of her own life, combined with caring for her aunt and trying to sell her father's house after his passing, finally took a toll.
So I've had to learn a lot of self-compassion, that I can't do it all. I'm not going to live so long if I do it all. And I have so much more to live for. I still have a son in high school, and I want to spend time with him.
I was going to say something about you, but I'm losing it.
Now serving as the only caregiver for her mom who has dementia, she attends a monthly support group at Jewish Community Services.
There's a lot of similarities, which I think is what I get from the support group, just recognizing that we all have the same feelings, whether I'm a child or a spouse of someone with dementia. We're all in the same boat. It's been sort of a healing experience.
So support groups are really essential for a lot of caregivers because what they find is that they're not alone in their situation. That when they sit in the room, there's just comfort of even being there to know that others are facing the same kind of issues that they are. And also they can talk openly about their situations, which they may not be able to do with their families because they don't want to burden them about their feelings.
Another thing to note is caregivers are often depleted both emotionally and financially.
AARP statistics show that on an average, a caregiver spends about $7,000 a year out of their own pocket to help a loved one.
When caregivers are trying to budget, one of the largest drains is prescriptions. Something people don't realize, insurance isn't always the cheapest option. And some pharmacists are banned from telling you that, which is why you always need to ask about the cash price and do your online research. What you pay here can be drastically different than what you pay here. Anywhere from a few dollars to, in some cases, an $80 difference. Wouldn't you like to know where you'll pay the least?
RX Saver is going to show you all of the places where you can save money. So it'll pull up the CVS, the Costco, the Walgreens, everything in your area.
You type in the medication, your location, the dosage, and RX Saver by Retail Me Not gives you prices. Here's a real-life example of those savings. With insurance, this cholesterol-lowering medication costs $30. Without insurance, the prescription costs $12. And with a coupon, you're paying just $4.
We've just been so trained to think that insurance is going to take the best care of us, but in fact, sometimes, like I said, insurance just isn't the cheapest option.
Since Lynn Waters retired in 2010, she's been looking for all types of ways to save money. She even managed to save more than $300 on one prescription.
I have insurance. My copay for 3 months was $400. And I'm going, it's one I need. I can't afford this every 3 months, but I need it. It really does work. I got on the phone. I went online, looked up the manufacturer, call them up and say, okay, here's my situation. I'm on fixed income, this medication, I really need it. It helps control the pain. Is there anything you can do to help me out? They said, sure. They sent me a discount card, so I went from $400 every 3 months to $12 every 3 months.
The key takeaway here, if you don't ask, you won't know. We'll be right back.
Being a caregiver is no easy task, but being there for the ones you love when they need you the most is a feeling that can't be explained.
We thank you all for joining us and wish you a long life lived well. Good night.